Think about this for a second. We put so much trust, really, in our healthcare systems. But how can we, as patients, how can we really be sure we're getting the best possible care? It's a question I think a lot of us have, right? Are the treatments working? Are the hospitals as safe as they claim?
It absolutely is. It's a fundamental question, yeah. And it gets right to the heart of what we're digging into today, healthcare quality, patient safety. It's a pretty complex area. And making sure those standards are high, that's a constant effort for everyone involved.
Exactly. And to really get into it, we've pulled together insights from quite a few different places. We've got the Joint Commission International, JCI. They're a big player setting global benchmarks. Then there's the National Accreditation Board for Hospitals and Healthcare Providers in India, NABH. They're focused, obviously, on India's system.
Right, more national.
And ISAQA, the International Society for Quality in Healthcare. They're a bit different, more about promoting improvement worldwide.
Yeah.
Nonprofit.
Yeah, collaborative.
Plus, we looked at a consultancy, Supremedic, that actually helps facilities with this stuff. And we even zoomed way in. We've got these detailed articles specifically on quality in radiology.
What's really useful, I think, is how each source gives us a slightly different angle.
Yeah.
You've got the big picture, international standards from JCI, and then these super practical details from the radiology guides. It gives a rounded view.
Precisely. So our mission today for you is to kind of weave these threads together, cut through maybe some of the jargon, the information overload, and just get a clearer picture of what quality healthcare actually means and how places are trying to achieve it. Okay, let's dive in. Where do we even start defining something like healthcare quality? It seems so broad.
Well, a good place to start is probably looking at what these main organizations say they're about, their missions. So JCI, Joint Commission International, they call themselves a global leader for healthcare quality of care and patient safety. And their mission, it's pretty direct, to enable and affirm the highest standards of healthcare quality and patient safety for all.
Quality and safety.
Exactly. It seems obvious, but putting them together like that really highlights something important. You can have great treatment, technically excellent, but if the environment isn't safe, it undermines everything. And the other way around, too.
That's a really good point. It's both sides of the coin. Okay, so that's JCI's global view. How does NABH in India frame it?
So NABH, being part of India's Quality Council, has a more specific national focus. Their job is setting up and running accreditation programs for healthcare organizations in India. They're really trying to set benchmarks to push the whole Indian health industry forward.
Right, so different scope, global versus national, but that same underlying goal of raising standards. And ISQA, how do they fit into this definition puzzle?
ISQA's approach is a little different again. They're member-based, not-for-profit, operating in, over 70 countries. Their main thing isn't direct accreditation like JCI or NABH. It's more about promoting quality improvement itself through education, sharing knowledge, external evaluation. They're really building a worldwide community focused on learning how to do things better.
Okay, so it sounds like we have these sort of complementary layers, JCI setting global standards, NABH accrediting nationally in India, and ISQA fostering this global learning network. Now, you mentioned accreditation. That seems key. It comes up a lot in the sources. How exactly does accreditation work to ensure quality?
Yeah, accreditation is definitely a cornerstone. For both JCI and NABH, it's a primary tool. It's basically a process where a healthcare organization is assessed against a set of known standards. Achieving that accreditation signals, okay, we meet these requirements for quality and safety. It's a public commitment.
And we saw some really interesting examples of what that JCI accreditation meant for hospitals. Like Hong Kong Adventist Hospital said it actually improved their teamwork and communication internally.
Yeah, that's fascinating, isn't it? It suggests the process of getting accredited can change the culture. It forces collaboration, gets people focused on the same goals, which, ultimately helps patients.
And then Virgil Farha Hospital mentioned the competitive edge it gives them and community confidence.
Makes sense.
Yeah, people see that JCI seal and think, okay, this place has been checked out.
Exactly. It's a strong signal. Patients, families, they can see this external validation. Emirates Specialty Hospital said something similar, enhanced patient confidence. And Corniche Hospital framed it as showing their continuous commitment to being excellent.
It really shows how much value these organizations place on that external stamp of approval. And interestingly, that consultancy, Supremedic, they specifically offer help with NABH accreditation, which suggests, well, it's probably not easy to get accredited. There's a need for help navigating it all.
Right, absolutely. It can be a massive undertaking. You have to really understand the standards, figure out how to implement changes, gather evidence. Having experts guide you can make a huge difference, help embed those practices effectively.
And JCI itself, it seems, doesn't just do general hospital accreditation. They have these other things too, like clinical care program certifications, and even one for healthcare sustainability.
Yes, that's important. It shows quality isn't static, right? It's evolving. It's not just
Mhm.
about the core hospital services anymore. There's this growing focus on specialized care for specific conditions.
Hmm.
And even, like you said, the environmental side of healthcare, sustainability.
Yeah.
JCI's pathway to accreditation also implies it's a structured journey for organizations.
Okay, so we've got the big picture. Organizations, accreditation, setting standards. But to make this really concrete for you listening, let's zoom in. Let's look at radiology. Why pick radiology as our sort of deep dive example for quality?
Well, radiology is a fantastic example because it's so central to so much of patient care. That Elevating Radiology Quality Guide really spells it out. It's not just about taking pictures. Fundamentally, it's about getting the diagnosis right. That's the bedrock for treatment.
Right. Can't treat what you don't know.
Exactly. Then there's radiation safety, using the absolute minimum dose needed. That's huge. Workflow efficiency, getting results quickly to the doctors who need them, making sure the equipment itself is working perfectly, and of course, the patient's experience through it all. Patient satisfaction.
That makes total sense. Radiology is often the first step or a key step in figuring out what's wrong. So, okay, within radiology then, what are the main things they focus on to ensure quality? What are the dimensions?
The sources point to three key dimensions: precision, performance, and safety. Precision is all about accuracy, accurate interpretation of the images, obviously, but also calibrating the equipment properly, using standardized ways of doing scans protocols, and having systems like peer review, where complex cases get a second look, just building in checks.
Okay, precision is about accuracy, consistency, getting the details right. What about performance?
Performance is more about how smoothly and effectively the department runs. So turnaround time for reports is a big one. How fast do the interpretations get back?
Crucial.
Yeah, making sure the machines are actually up and running when needed. Good scheduling, minimizing wait times for patients. Faster turnaround isn't just convenient, it can genuinely affect outcomes if treatments start sooner.
Right. Speed and reliability. Got it. And the third one, safety. That seems pretty self-explanatory in radiology with radiation involved.
Absolutely critical. Safety involves meticulously tracking and minimizing radiation dose, following that LAR principle, as low as reasonably achievable. It's also about handling contrast agents safely, the dyes used in some scans.
Okay.
Basic stuff, too, like infection control in the imaging suites, and just general awareness of potential hazards.
Okay, so precision, performance, safety. Across those three, how does a radiology department actually know if it's doing well? Are there like specific numbers they track?
Oh, yes, definitely. There are several key metrics they watch closely. Report turnaround time, like we mentioned, often different targets for urgent versus routine scans. Peer review discrepancy rates. How often does a second read find something different? That tells you about interpretation accuracy.
Mm.
Radiation dose index monitoring, making sure doses are within accepted national levels. Repeat scan rate. How often do they have to redo a scan? That impacts efficiency and patient dose.
Ah, good point.
Patient satisfaction scores, obviously.
Yeah.
Direct feedback. And tracking equipment downtime. How often are machines unavailable?
Wow, those are all really tangible things you can measure. You can see how tracking those would give a clear picture of strengths and weaknesses. And the sources also talked about specific initiatives departments take to improve. What kind of things are they doing?
All sorts of things.
Yeah.
To boost accuracy, maybe implementing double reads for tricky scans or using AI tools to help spot things.
AI, interesting.
Yeah. For workflow, they might better integrate their PACS system, where the images are stored, with the RIS, the scheduling and patient data system, makes things smoother. Automating how cases get assigned, using smart schedule. For radiation safety, dose tracking software is key, plus ongoing training for the techs and doctors.
Training seems vital.
Absolutely. Similar things for contrast, safety screening for allergies, alert systems, and focusing on the patient experience, better communication, shorter waits. And yeah, comprehensive staff training on everything, especially new tech and quality procedures, underpins it all.
It sounds really proactive, like they're constantly looking for ways to fine-tune everything. And it's fascinating how much technology is involved now. You mentioned AI. The guide also talked about structured reporting templates, dose management systems.
Yeah, these innovations are really changing the game in radiology quality. AI can be like a second pair of eyes, catching subtle things maybe. Doesn't replace the radiologist, but helps.
Augments them?
Exactly. Structured reports make the findings clearer, more standardized for the doctors reading them. Easier to pull out key info. Dose management systems give real-time feedback, helping optimize radiation levels. Automated workflow engines speed things up. Peer learning platforms help radiologists keep learning from each other. Digital dashboards show all those key metrics at a glance.
It's like applying data science to healthcare quality, in a way. Very cool. And the guide had real-world examples, too. The NHS in the UK standardized reports cut down CT turnaround times. Simple change, big impact.
That's right. Standardization improves speed and communication. Less ambiguity.
And Singapore General Hospital used AI for spotting lung nodules. Found it improved accuracy significantly compared to radiologists alone.
Wow.
That really shows the potential of AI, doesn't it? But it does raise a question, though. With AI getting better, how do we make sure that precision doesn't accidentally push out essential human judgment?
That's a really critical point, and it's something the field is actively grappling with. The key is seeing AI as a tool. It augments, it doesn't replace the radiologist's expertise. You need robust testing of these AI algorithms, proper training for the humans using them, and clear protocols about where the final decision lies. Human oversight remains essential, especially for complex or critical findings.
Okay, so it's about responsible integration. Makes sense. And then Tata Memorial in Mumbai focused on radiation safety training and protocols. Result, lower average patient radiation exposure.
Exactly. Shows the direct impact of focused education and just sticking to best practices consistently.
So, okay, let's say a radiology department wants to start or improve its own quality program. Where do they begin? What's step one?
Well, the guide lays out a pretty logical process. Usually starts with a baseline audit. Figure out where you are right now. What are your current discrepancy rates, turnaround times, dose levels, repeat rates? Get the data.
Know your starting point.
Precisely. Then set SMART goals. Specific, measurable, achievable, relevant, time-bound. What do you want to improve? By how much? By when? Crucially, form multidisciplinary teams. Get radiologists, technologists, nurses, IT people, maybe even referring doctors involved. Everyone have a piece of the puzzle.
Collaboration is key.
Totally. Then use something like the PDSA cycle plan. Do, study, act. It's a structured way to test changes.
Can you quickly explain PDSA?
Sure. So you plan a change, maybe a new workflow. You do it, implement it, maybe on a small scale first. You study the results. Did it work? What happened? Then you act based on what you learned. Adopt the change, adapt it, or maybe abandon it if it didn't work. It's iterative.
Like little experiments.
Kind of, yeah. And importantly, get feedback. Talk to patients. Talk to the doctors who order the scans. Are the changes actually helping them? And finally, keep monitoring those key metrics. Use dashboards. Track progress continuously. It's not a one-off project.
It really sounds like a cycle of continuous improvement, but I bet it's not always smooth sailing. What kind of roadblocks do departments hit?
Oh, for sure. There are challenges. Just the sheer volume of scans radiologists have to read daily, that creates huge time pressure. It can be hard to carve out time for QI work when you're just trying to keep up.
The workload issue.
Definitely. Sometimes the data systems aren't great, hard to track metrics effectively if the infrastructure isn't there. And sometimes there's a bit of fear around peer review. People might see it as criticism, not learning. Culture matters there.
Yeah, psychological safety.
Exactly.
Yeah.
And communication gaps. Sometimes referring doctors don't provide enough clinical history, which makes interpretation harder.
So how do you tackle those? What are the solutions?
Well, for the workload, maybe start small. Pick one or two manageable QI projects. Don't try to boil the ocean. For peer review, really focus on creating that non-punitive learning culture. Frame it as improvement, not judgment. Technology can help too. Automation, structured reporting, things that save radiologists time.
Free them up a bit.
Right. And proactively work with referring doctors. Educate them on why good clinical information is so vital for accurate imaging interpretation. Better input means better output.
You know, it's really striking how these specific radiology examples just perfectly mirror those big principles from JCI and ABH, ISQA. It really does all come down to setting standards, measuring how you're doing, and just committing to getting better all the time.
Precisely. JCI and NABH provide the frameworks, the standards, the accreditation structure. ISQA builds that global community for sharing ideas and best practices. But the core ideas in action in radiology, using data, working across teams, focusing relentlessly on patient safety, those are universal in healthcare quality improvement. ISQA's whole mission around fostering that global learning community really highlights how collaborative this all is. Nobody improves in a vacuum.
And when you boil it all down, the person who benefits most from all this focus, all this effort, is the patient.
Right. Absolutely. At the end of the day, that's the goal. Faster results, more accurate diagnoses, safer procedures with less radiation.
Mhm.
It all leads to better patient outcomes, a better experience overall. And when you track things like turnaround time or patient satisfaction, you're directly measuring things that matter to the patient.
We even saw that mention of patient-driven imaging, patients getting their own reports and images.
Yep.
That must make clear communication even more critical.
It certainly does. Patients are becoming more informed, more active partners in their care, so providers need to make sure that the information they share is clear, understandable, and actually empowers the patient. It's a shift towards greater transparency.
And looking ahead, it definitely seems like this is an ongoing journey, constant evolution. JCI has that Unify 2025 conference coming up, focused on solving challenges together. ISWA has big international conferences lined up for São Paulo in 25, Dublin in 26.
Yeah, these kinds of events are crucial. They keep the conversation going globally. It's where people share the latest research, new technologies, what's working well in different parts of the world, keeps the momentum going. And even Supreme Medic's vision supporting healthcare development and innovation that points to the ongoing need for expertise to actually implement these quality systems effectively.
Okay, so as we wrap up this deep dive, what are the main things that stick out to you, the big takeaways?
For me, it's really the interconnectedness of it all. You have these different organizations, global, national, collaborative networks, all pushing towards the same fundamental goals: better quality, safer care. Accreditation is clearly a key piece of the puzzle, a mechanism to ensure standards are met. And looking closely at radiology just shows so clearly how specific metrics and focused initiatives can make a real difference on the ground. It makes the abstract concepts very concrete.
And for you, listening, we hope this deep dive gives you a better sense of all the work happening behind the scenes. It's not always obvious when you're the patient, but there are systems and dedicated people constantly trying to make healthcare safer and more effective for you.
Exactly. Understanding these concepts hopefully makes you a more informed patient, more aware of the complexities, but also the commitment to quality care that drives so many healthcare professionals.
So here's something to think about as we finish, considering everything we've talked about today. From those high-level international standards set by JCI down to the AI being used in a radiology scan, what single factor do you believe has the biggest impact on the quality of care that you personally receive? Is it the hospital's accreditation, the latest technology, or maybe it's something more personal, like how well your doctors communicate, how listened to you feel? Just mull that over. What does quality healthcare truly mean to you?